Hello, this is Dr. David Green, CEO of the Nevada Pain Network. The topic today is what you need to know about peripheral and diabetic neuropathy. There are 20 million people in the U.S. suffering from diabetic neuropathy and another 20 million who suffer from the other types of peripheral neuropathy. Neuropathy involves damage to nerves that are outside of the brain and spinal cord, so those are called peripheral nerves. There are three types of neuropathy. One is mononeuropathy, where it's one nerve, and that could be compression of carpal tunnel, it could be cubital tunnel, tarsal tunnel, but we're just talking about one nerve. Polyneuropathy, which is several nerves, and the most classic example is diabetic neuropathy. And then mononeuritis multiplex, which is two or more nerves in different areas of the body. For example, Lyme disease. So that's much less common than either of the other two. What are the causes of neuropathy? There are over 100. Here's a small list. Diabetes. That is by far and away the most common reason. Excessive alcohol intake, chronic kidney issues, liver infections, vitamin deficiencies, autoimmune diseases, blood flow insufficiency, heavy metal toxicity, radiation or chemotherapy, infections such as HIV and hepatitis, tumors, underactive thyroid or amyloidosis, all those can lead to neuropathy. The symptoms vary between patients. It can be mild or it can be absolutely disabling. The lower extremities, it's usually both or both arms and hands involved. Early on, you see tingling, burning, pins and needles sensation. When it becomes moderate to severe, it actually just gets more severe burning and a searing pain. It can be very unique and just disabling. It can actually be depressing, and patients can feel isolated because most of their friends and family have no idea what it feels like. It's so bad. End stage, usually you lose sensation altogether as it goes on and on. Patients often get weakness, instability, dexterity issues. They can have a tough time walking. If the hands are involved, they can have difficulty handwriting or buttoning their shirts. And then you can have organ dysfunction, including bladder, cardiac, and kidney issues. Treatments for neuropathy, the main thing is to control the blood sugars or control the other inciting issue. If it's heavy alcohol intake, then, cut back on the drinking, or heavy metals, cut back on the toxicity. Medications for pain relief include nonsteroidal anti-inflammatories and Tylenol. Opiates can be helpful for pain relief, as well as neurogenic medications like Neurontin and Lyrica. Also, pain creams provide direct pain relief in their prescriptions, so they're much stronger than over-the-counter. Physical therapy, chiropractic treatment can be helpful. TENS units, like you see on the right here, can be helpful. They're very low risk, and they're the size of an iPod. There are injections for specific nerve compression. For diffuse neuropathy, injections aren't really going to help, but they're, for specific nerves, it can be very helpful. Spinal cord stimulator implants have been revolutionary for neuropathy. Studies show that they can provide over 80% pain relief. 85% of patients had improved sensation with the implants, and 58% actually had their sensory deficits reversed completely. So it helped with pain relief, and it helped with sensation and the ability to walk. It's an outpatient procedure. It's relatively low risk. It is a very expensive implant, but insurance does cover it. There's a surgical procedure called the Dellin decompression procedure, which as a last resort can be very helpful as well for neuropathy. The outcomes, it is hard to completely reverse neuropathy. You can stop it in its tracks with proper treatment, but it's very hard to reverse it. It can often be controlled. The variety of non-operative treatments that are available, the vast majority of patients achieve a dramatically reduced level of baseline pain, and this allows individuals to increase activity and avoid surgery. Nevada Pain is the top pain management clinics in the Las Vegas and Henderson area. They really are a one-stop shop. They have board-certified pain doctors who offer medical and interventional treatments, chiropractors, PT, acupuncture. There are several locations with over 50 insurances being accepted. They've won the Patient's Choice Award 5 years in a row. And the number to call for treatment is 702-323-0553. And visit us on the web at painmanagementlasvegas.com. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.